Suboxone contains a combination of buprenorphine and naloxone. Buprenorphine is an opioid medication. Naloxone blocks the effect of opiate medication, including pain relief or feelings of well-being that can lead to opiate abuse. Suboxone is used to treat narcotic opiate addiction. Suboxone is not for use as a pain medication. How should I take Suboxone? Before taking a Suboxone sublingual film, drink water to moisten your mouth. This helps the film resolve more easily. Place one film on the inside of your right or left cheek. If your doctor tells you to take 2 films at a time, place the other film on the inside of the opposite cheek. Keep the films in place until they have completely dissolved. If your doctor tells you to take a third film, place it on the side of your right or left cheek after the first 2 films have dissolved. While the film is dissolving, do not chew or swallow the film because the medicine will not work as well. Suboxone sublingual tablets should be placed under the tongue until they dissolve. How to use? Usual adult dose for opiate dependence. Induction. Induction for those dependent on heroin or other short-acting opiate products. Initial doses should begin when objective signs of moderate opioid withdrawal appear and not less than 6 hours after the patient last used opioid to avoid precipitating an opioid withdrawal syndrome. Suboxone sublingual film. Day 1. Up to 8 mg, 2 mg sublingually. Administer as an initial dose of 2 mg, 0.5 mg, or 4 mg, 1 mg with titration in 2 or 4 mg increments of buprenorphine at approximately 2 hours intervals. Day 2. 16 mg, 4 mg sublingually as a single dose. Usual adult dose for opiate dependence, maintenance. Suboxone sublingual film and sublingual tablets. Progressively adjust in decrements of 2 mg, 0.5 mg or 4 mg, 1 mg to a level that holds the patient in treatment and suppresses opioid withdrawal signs and symptoms. Recommended target dose 16 mg, 4 mg sublingually film tablet or buccally film once a day. Dose range 4 mg 1 mg to 24 mg 6 mg. Maximum dose 24 mg 6 mg per day. Contraindications: hypersensitivity to the active substances or to any of the excipients, severe respiratory insufficiency, severe hepatic impairment, acute alcoholism or delirium tremens, concomitant administration of opiate antagonists, naltrexone and nalmefene for the treatment of alcohol or opiate dependence. Suboxone side effects: get emergency medical help if you have signs of an allergic reaction to Suboxone, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call a doctor at once or seek emergency medical attention if you have any problems with your teeth or gums, weak or shallow breathing, breathing that stops during sleep, a lightheaded feeling like you might pass out, confusion, loss of coordination, extreme weakness, blurred vision, slurred speech, liver problems, upper stomach pain, loss of appetite, dark urine, clay-colored stools, jaundice, yellowing of the skin or eyes. High levels of serotonin in the body, agitation, hallucinations, fever, sweating, shivering, fast heart rate, muscle stiffness, twitching, loss of coordination, nausea, vomiting, diarrhea. Low cortisol levels, nausea, vomiting, loss of appetite, dizziness, worsening tiredness or weakness. Opioid withdrawal syndrome, shivering, goosebumps, increased sweating, feeling hot or cold, runny nose, watery eyes, diarrhea, muscle pain.